I want to say thank you to members of the public that have turned out this afternoon, certainly the media. We know there are a lot of people who are watching live stream or who will be watching these comments later in the day. We wanted to get together and talk to the public and talk to our folks in public schools about what we are doing around the issue of the novel coronavirus or COVID-19. We'll start by saying, as of this moment, we still have no confirmed cases in Alabama and certainly no confirmed cases in Alabama schools. That does not mean that we should not be prepared. As we see, most of our neighbor states now do have confirmed cases, and there are cases obviously all over the country and all over the world. So we are making plans. We have been making plans for several days, and we continue to update those plans. A couple of things here, and then I'm going to turn it over to some other people. First, you see some folks behind me on the stage. Dr. Scott Harris, who is the Director of Public Health, a state health officer for Alabama, and leads the Department of Public Health. And Dr. Harris is going to make a few comments after I do. Also behind me is Brian Hastings, who leads our state's EMA, and as Director of EMA is giving daily updates to the Governor's Cabinet and other folks across the state who need that information. And then to the right behind me is Jennifer Ventris, who is our state school nurse and works in the Department of Education on a regular basis, communicating back and forth with school nurses, principals, superintendents, and others who need on-the-ground guidance about a lot of issues, and certainly this issue is taking a lot of our time now, and we'll all have comments and be helping to answer questions in just a few minutes. I also want to give great credit to our governor. Governor Kay Ivey has been very proactive. She put together last week a task force of state leaders to begin pulling our plans together. Individually, our agencies and schools were already making plans, but she decided she needed to pull all of us together to make sure we had a unified state response. We've already had 2 meetings of that task force. Dr. Harris, again, who's the state health officer, is chairing that task force, working for the governor. So we are continuing that work, and we're continuing to communicate with other states. Our governor serves on the national response team with Vice President Pence, and so she's getting regular briefings from them, and we're turning that information around to update our plans in the state. So I want to say just a couple of things specifically about schools before Dr. Harris comes up. Again, we have no confirmed cases in schools in Alabama. We've sent out a couple of pieces of guidance to local superintendents about how to react, how to look for cases, and these are kind of the main things that we are looking for. Number one, if you have a student or a parent, faculty member, someone who has traveled overseas, or now we're saying has traveled to one of the hot spots where there's been a large outbreak of coronavirus, like Kirkland, Washington, we know was an early hot spot in the country, then we need to at least know that. They need to make sure that their school administration knows about that and their local public health department knows about it. If any of those people then begin to have symptoms, flu-like symptoms, then we ask that they go to the health department, go to their medical provider, one way or the other, and they need to be tested if it's their doctor's advice to be tested. Again, that's up to the local physicians and public health to decide who needs to be tested, but at least they need to go and be seen by a doctor if they have these symptoms and they've traveled to a hotspot area. There may be other folks who feel like for some reason, they're worried about it, they have the symptoms, they're running a fever, and they want to go see their medical provider. And we encourage them, go see your medical provider, and then let that medical professional make the decision about what needs to happen next. Another issue is that we are guiding local school districts now not to allow students to travel overseas. So it's not necessarily just about catching the virus overseas, but we are seeing a rash of confinements overseas and quarantines. So many countries are requiring folks to be scanned at airports and are quarantining citizens who are traveling. And so we feel like it's just not a good situation for our students to be traveling overseas when there's such a heightened alert, and students might end up being quarantined overseas for a number of days. So we've encouraged them to cancel trips that are going overseas over the next several weeks. We've been getting some questions about other issues, And the truth is, right now, we just don't have a lot of guidance until we see if a case eventually becomes confirmed in Alabama, where the case is, how many more people that might involve. And so we do have response teams out there. We do have plans, but until a particular case comes to us, we don't know how strong a response we're going to have. So what I'd like to do now is turn it over to Dr. Harris again, and then Director Hastings is going to speak. And then after they both have a little bit of time to speak, we'll just open it up for individual questions. Dr. Harris?
Sure. Thank you, Dr. Mackey. Thank you all for joining us today. I'm Scott Harris. I'm the State Health Officer. We appreciate you making time to join us today. As you're aware, there are no cases of coronavirus so far in our state. We stood up our testing capacity here in Alabama last week. About a week ago, we have tested a number of folks who have been referred to us and have not found any positive tests so far. We expect at some point that we will. As you know, many surrounding states in the Southeast have cases now. There are more than 35 states, approaching 40 states in the country that have found cases. And as states stand up their testing and begin to look, we are certain that more cases will be found. There's more than 750 cases in the U.S. so far, somewhere between 25 and 30 deaths that have occurred so far. We have been in a mode of prevention and monitoring for the last 2 months. We have been working with the Department of Education and appreciate Dr. Mackey and his team and the efforts that they've made with us to plan and prepare over the past several weeks. We believe that we have a good plan in place. We certainly understand that people are concerned and worried about the unknown. We have tried very hard to make sure that Alabama is prepared and that we have the appropriate measures to respond should that happen. Governor Ivey has really taken a lead on this, which we are grateful for. Standing up her task force was a very important move, I believe, and she's taken a personal interest in that and has been involved in all those meetings so far personally, directly, and so we certainly appreciate her interest and her support. We, as I mentioned, have been in a mode of preparedness and surveillance and monitoring at this point. We have monitored a number of people who have returned to Alabama from other states, more than 100 travelers who may have had some exposure to coronavirus. And so we make contact with those individuals when they return to the state. We advise them on how to monitor themselves and to seek care if they become ill. We check in with them daily, have them checking their temperatures a couple of times daily. And most of those travelers that we have monitored in that way have now completed monitoring and are thought not to have risk of disease. We continue to monitor a few more from time to time. What's changed in the past few weeks are the number of other countries that are seeing the disease. And so we have reached out to many other groups to assist us in the efforts to make sure that Alabama stays safe. For example, college students who are returning from overseas, in most cases, we're working through their student health programs at these institutions of higher education so that they can assist with making sure that these students isolate if appropriate or receive medical care if appropriate. I would like to add on to what Dr. Mackey mentioned earlier. If you have symptoms and believe that you're ill, we would ask you first to pick up the phone and call your provider, talk to them, describe your situation, and see if there's any risk that you might have for corona disease or any reason your provider would want you to be tested. And this is really just a way that we have people who may actually be ill or may actually be at risk of transmitting the disease to avoid other groups of patients, showing up in an emergency department, for example, or showing up in a doctor's office, for example. So we have worked with providers every day. We get many, many calls a day from providers in the state who have questions about whether a person needs to be tested or not, and we are very proud of our capability in being able to handle that so far. I do have a message for those of you that are involved in our school systems. Just a few things to remember. I think many of you have been planning for this for weeks, but certainly this is a great time for you to review your emergency operations plan for an outbreak. Just in case this happens, you guys are probably used to doing this every year during flu season, and this is another time that we would request that you do that. this is a good time to talk to school children about hygiene, like you probably do all the time. But just remember good cough etiquette, good hand hygiene, washing and avoiding touching your face, covering your cough and sneeze. And really one of the most important pieces of advice we can give to parents and to teachers is have kids remain at home if they're sick. It's really important. As a parent myself, I understand that it's a lot easier for me to say that than for parents to do that. But if you have kids that are sick during this time, please try to keep them at home. When you have kids, if and when you have kids at school who become ill, who have fevers, try to think about a way to make sure you can keep those kids separated from other folks who may not be sick so that there's no risk of spreading anything. So finally, I would say we would encourage administrators and faculty to stay caught up on the news, stay caught up on what's going on with COVID-19 disease. There are a number of sources, and all of us have kind of our own favorite sources of information, but CDC on their website has a great update that's available every day and can give you great information. Starting this Friday, Public Health is going to do a webcast. We hope to do, not sure of the frequency, but probably weekly or somewhere on that order, which will be open to anyone who wants to listen, and we'll take questions on that. The first webcast is going to be this coming Friday morning at 10 a.m., and after this is over, we'll get information to you on how folks can dial in and listen to that. So that's all the introductory comments that I have right now, and I'm going to turn it over to Director Hastings from Alabama EMA.
Thanks, Dr. Harris. Thanks, Dr. Mackey. So I'm Director Hastings, the Director of Alabama Emergency Management Agency, and one thing I do like to emphasize is that the Alabama Department of Public Health and our Public Health Officer, Dr. Scott Harris, they have the lead in public health response in Alabama. So the Alabama Emergency Management Agency and all the state agencies and our 67 counties and tribe will be in support of managing public health's lead in this incident. And I've had a close working relationship with Dr. Harris for almost 3 years now, as we came on board at the same time and met actually prior to both of us joining the state government. I do want to share with you just a couple things that I've been sharing with the Cabinet as I share daily updates with them, the data across the globe and also in the United States. So recently, if you guys have been looking at the data, it actually shows that we're increasing about 25 to 30% daily. So about every 4 days, we should expect the numbers to double. So no one should be surprised by that. This is just managing some expectations here. This is called infectious disease. The one thing I would caution us on, and I'm going to knock on wood here, is that we have no confirmed cases in Alabama. That doesn't necessarily mean we don't have a case in Alabama. What we've seen is that in the younger populations, they sometimes just have the sniffles, the cold, and they go about their business, right? And diseases affect people differently. So as testing becomes more available, some of those numbers may rise. So to wait for those numbers is not the time to start preparing. So these are the conversations that we need to have. And I hope that you're having them with your family and your children, because I'm having them with my family and my children also. The one thing I wanted to also mention is that you'll hear in the news that from the data, and that most of the data is coming from outside the United States, and we do have some data in places like California, Washington, and recent unfortunate fatalities on the East Coast, is that this is really affecting the elderly. And the younger population is got a lower mortality rate right now. So that's favorable for our children, but it's not for a vulnerable population of the United States. So we really need to think through that. So as we put all that data together and think through who we are as Americans, we're very social. We like face-to-face and contact. We need to think about how do we reduce the transmissivity of this disease. And it's the things that we should be doing all the time. It's just that we don't do it until there's something that's approaching a crisis. So if we do those things that Dr. Harris has said, and we've all talked about, is you wash your hands, you cover your cough, try to cover it with a napkin, a cloth, or you crux your elbow. Don't touch people's faces or your own faces. If you can, and you may have seen me earlier, just like did an elbow or a knuckle, I'm not going to touch the pad of my hands and shake hands right now, and it's so uncomfortable. It is so hard not to shake someone's hand, especially in Alabama, because we're a handshaking state. That's what we do. So that personal hygiene is very important. The other thing that is important is our social and our professional hygiene. Whether you're going to conferences, how big are the rooms that you're going to? What's the closeness of this? Is it very dense? Are you washing and cleansing your workspaces? And this goes for everyone. This isn't just schools. This is in your home and our small businesses that may be susceptible to this. 70% of Alabama's economy is small businesses. Are we thinking through this? And the task force, one of the things that we're supposed to do is think through the interconnectedness and the cascading effects of something, right? What happens if a school shuts down? Where do those kids go, right? Okay, so then where does mom and dad go? Are they going to work? And then what do the businesses do? And so these are the things that we just need to think through. Just take some time and think through and ask the questions, because it's sometimes those questions, not knowing the answer, but knowing what questions to ask, which leads to a really interesting solution. And this isn't going to be a public health solution, and this isn't going to be a Dr. Mackey solution. This really has to be a whole of society solution, because we can have the best plans and we can have the best protective measures, but if you and the people around you are incapable of hygiene, washing hands, covering coughing, practicing social distancing and social isolation, calling a doc, going to doc, don't hang out with sick people, disease containment is not going to work. It will not work. It takes everyone on this one. So the guidance that's given out, we need to really think about those good habits and instill them in ourselves, the people around us, and model that behavior that we need. Because if you do non-pharmaceutical measures well, you can reduce the transmissivity of an infectious disease 15 to 20%. That is significant. Why is that important for all of us here? Is you're hearing talk right now on the media that some of the medical systems are being overwhelmed, locally and maybe regionally, right? If we can slow the transmission down and spread that out over a longer period of time, you won't have these huge spikes like we had in 2018 with the flu, when we had to declare a public health emergency and a state of emergency because our hospitals were filled. And it wasn't necessarily that the hospitals filled were sick people, the doctors and the nurses were sick, so the whole system was just struggling, and we had to go to alternative standards of care. So if this, we're in this together. So we need everyone's help. And if we all do our part, I think we're going to fare very well. And I'm just very fortunate that we have leadership, we have a good cabinet, people are talking, we're thinking, and we're so fortunate that we don't have confirmed cases right now. We have some time, but we have to act. We have to think and plan. It's a whole society effort. Thank you.
Thank you. Again, thank you, Director Hastings and Dr. Harris, for your comments and for your help and for your partnership in doing this. As Dr. Harris mentioned, he and I have been talking now for many weeks about this and making our plans and working together. And Director Hastings and I have been working together too on this and on other things. And we appreciate him taking time out when he's got weather to monitor too to join us today. So with that, I know there's probably lots of specific questions from the media, and we'll take questions. And Dr. Sibley, would you help me just kind of organize the questions as we go around?
Absolutely. Well, the thing here is there's a mic in the air, so you don't have to hand around your individual mic. We'll, if it's okay, just go from left to right.
Start this side? Okay.
Start with this side of the room.
How many people have been tested for corona so far, and what's the status of our capability to test for it?
Sure. Yeah, I'll be glad to address that. The number is it's changing frequently, and so I don't know exactly, but still less than 20 so far since we started our testing last week. I think the first tests we did were on Thursday of last week. You may remember 2 Thursdays ago in the United States there were 7 total labs testing, state labs that were testing, and then by the end of last week there were about 47 labs testing. So most states, including Alabama, really came online last week. So we have something less than 20, I don't know exactly, but we're handling dozens of phone calls a day for people who are inquiring about testing. In terms of the capability, we believe if we had everyone up to speed, fully trained, everything completely ready to go, we could do 150 tests a day. Probably there's not a need for that at this time, and we have plenty of capacity now to handle the ones that we're doing. So.
What is the protocol on who gets a test? Do you test for flu first?
Sorry.
And do you test for flu first and then strep and then move to coronavirus, or is there a?
Sure. It's a long answer. First of all, I want to add that there are at least a couple of commercial labs that are doing testing at this time. So Quest and LabCorp, I know, have tests up and running. Some of our academic medical centers are actually developing their own tests and expect to be doing that soon as well. So in public health, we're not the only ones doing tests. As far as criteria for testing with those labs, that's between a provider and those labs, I guess. For public health, we have emphasized that we want to test those people who are most at risk for the disease or most susceptible to serious complications. The average person in Alabama doesn't need a test. People who do not have symptoms at all, in almost all cases, do not need a test. The rare exception to that has been people coming from cruise ships that were infected, and the federal government was trying to determine whether someone was infected before they transferred them around the country. So those are really the only asymptomatic people who have been tested or really should be tested. Our criteria in public health have a series of clinical criteria, including fever or cough or shortness of breath, and then they either have to be someone coming from one of these level 3 countries where transmission is actively going on, or they have to be someone who's exposed to a known case, either a close contact or a family member or a healthcare worker. Or in some cases, we will test symptomatic people who are at higher risk for the disease, such as older people or people that have chronic health problems. We are also testing hospitalized patients who meet these criteria, who are sick enough to be hospitalized, and who have had everything else ruled out. And of course, ruling out everything is part of a clinical workup that a provider would do, and we don't tell them exactly how to do that. But I would say, generally speaking, that involves culturing them for the routine things that cause lung infections, or performing PCR tests on the sputum looking for pathogens that can do that. If all those tests are negative and someone is still ill in the hospital, then we will test that patient according to our criteria as well.
Trish.
Trish Crane at AL.com. So a couple of questions about schools directly. First of all, you mentioned the emergency operation plans. Are schools expected to have in their emergency operation plans plans for outbreaks of infectious disease? Is that one of those categories?
Yes. And so schools do have plans in their emergency operation plans for what to do in the case of an outbreak. But, those need to be updated. And so what we've been encouraging them is to update those plans, to look and make sure that, for instance, the people they have to contact, all those things are in place. And we've asked schools, superintendents, or we've directed them not to let us know if they get a positive case, even though we would be getting that notification through the health department. We would like to make sure we get as fast a message as possible. So if they find out that there's a confirmed case of a student or a faculty member or a staff member, then we want to know that immediately and then proceed to helping them make a decision about what to do next in that situation.
Okay, and as a follow-up, please, what kind of guidance are you giving to schools? A couple are out on spring break this week, and we're talking about K-12 schools. A couple more next week, the last week of March, everybody's out. What are you giving? What are you telling them about? Should we do our travels for spring break? Should we go on field trips? Are these local decisions?
Sure, that's a good decision. Good question. Those are local decisions right now. So we have only recommended that they cancel travel overseas. Travel within the state and even travel outside the state, as long as they're within the United States, we've not recommended canceling travel. Local school boards can do that if they want to. But the caveat to that is depending on where you're going. So obviously, if there's a trip that's planned to an area that has a known outbreak or is a hot spot, or there are now a couple of places in the country where there have been declared specific states of emergency, and those communities have been kind of locked down. So if that's the case, then we would say don't travel to that area. But that right now is only guidance we've given. And I want to emphasize that is subject to change because this is changing daily. We are getting more information, obviously, as has been stated already, from both within the United States and overseas. And so as this changes, that could change. So an example of that is 2 weeks ago, we were not recommending to cancel overseas travel. But as more and more countries were starting to quarantine both their own citizens and international travelers, and we decided it'd be better not to put our students in that kind of a risk. And let me say this, so spring break, we do have a couple of schools out this week, a few out next week. I think there are 8 school systems about that are out next week. The week after that, the week of the 22nd, 90% of the K-12 students in the state will be on spring break that week. And then there are a couple of others that will be the week after. So we have somebody on spring break every week in the month of March. But the vast majority, over 90%, are out during the week of March the 22nd.
A couple of questions. We'll start here and then we'll go right here to WSA.
Yes, Dr. Harris, the level of testing in Alabama I know remains comparatively low to many other states. From my understanding, the protocol would be that a person would go to a physician or doctor, they would do some sort of evaluation and then request the coronavirus testing from ADPH. Has ADPH denied any requests from physicians for COVID-19 testing?
We've had requests that just weren't appropriate candidates for testing, yes. So we've had, I can't begin to tell you how many calls daily, and the large majority of those calls are really requesting information. Providers are new to how we perform these tests and who's a candidate for those, and so most of those calls have just been explaining who is a valid candidate and who is not for testing. But most people in Alabama at this time actually don't need testing. We understand why people are concerned and want to answer the question of whether they need to be tested. But at this time, there's not community transmission that we're aware of in the state. So asymptomatic people, which is always going to be most people, don't need to be tested. So calls about people that have no symptoms at all and no other risk factor are not ones that we're going to be approving for testing.
What's the turnaround time from the time you can get the test to the time that you have a result?
Same day at the moment, or maybe if it came in late on the day, it might be the next morning, but essentially just a few hours.
And I do have a question for Dr. Mackey. Looking far ahead, is it the school or district's decision to close in the event they do have some sort of outbreak locally, or is that the state's decision, and what is that threshold?
That's an excellent question, and that decision will be made in conjunction with our department and the Department of Public Health. So the direction we sent to superintendents last week was that for them not to close schools or to cancel major events without checking with us first. And so we're following protocol with the Department of Public Health. So again, I'll have to preface this answer with there are no confirmed cases in Alabama. But if there were a confirmed case of a student or a teacher or staff member, somebody who worked in a school, this is how we would handle that. We would close that school for 24 to 48 hours and then assess the situation. So that's where public health comes in. They do an assessment. So they find out that person that has tested positive, about their family members, about their travel, about how many people they are around. Do they work in just one school, or would this be an itinerant teacher who might be in multiple schools during the day? And so those things, during that 24 to 48 hours, we would assess those things and make a decision about whether that school needed to be closed for a longer period or not. Or if, and again, big ifs here, but if in the case that there was an itinerant teacher, let's say, who went to 3 or 4 different schools during the day, then we might make a decision to close a cluster of schools. And those are the things that there's just not a flow chart, yes or no, but those decisions would be made in conjunction with, obviously, the local superintendent, our department, and the Department of Public Health, but they should not be made in isolation. And then we would have to, if there's a case and in a school, then obviously we have to go out from there and see was this person maybe were they a softball player, and if so, then are there implications for other teams that they've played? And we just have to ask those questions when we get there. So I think the thing we want to emphasize today is we've talked about all that, and we have plans for how we would handle that. But I think to the direct answer to your question is that would be a decision made between our two departments and working in conjunction with that local school superintendent.
Like you guys said, the elderly population is more vulnerable to the virus. What precautions are we taking with nursing homes here in Alabama?
Good question, Dr. Harris.
Sure. Nursing homes and assisted living facilities and specialty care assisted living facilities are groups that we have also been in contact with a lot over the past few weeks. In fact, I have a call with them a little bit later today with their membership throughout the state. We have worked really closely on how to develop ways to make sure that their residents stay safe. So, for example, signage, so that when visitors arrive, they understand that they should stay away if they're ill, to notify folks inside before they enter if they have any questions at all about their health. We have talked to them about the possibility of limiting visitation in some cases, and they have a plan in place, just like other healthcare facilities have, about what to do and what steps to take if there is an increased risk of outbreak in the community. Assisted living facilities have a little bit, they're a little bit different in that they can't limit visitation the way that a nursing home does, that they're a different animal, I guess you would say, but we are communicating with them ways to make sure that their population is aware of risk, and so maybe residents of those facilities can communicate to people who might visit them, please stay away if you're ill, and then if we had a case, then that would be a different level of response altogether, of course, and we have been working on plans to address that sort of thing if it were to happen. If there was one, I was just reminded of one thing I should have mentioned to the previous questioner. The public health declared or issued an emergency rule last week that would make this disease a reportable disease. And so this is a brand new disease. It didn't exist as far as we know even a few months ago. And public health has a list of diseases that we consider notifiable to public health. So an example that everyone has probably heard of is if there were a case of anthrax in the state. Besides taking care of the patient, it's also important to notify public health as quickly as possible because of the public health implications of that. We have a process for amending that rule that allows us to make something notifiable, and like all rule processes, it takes 2 or 3 months and public comments and the whole administrative rules process. So we use the statutory authority we have to declare an emergency rule, which we can do for about 120 days, and say this is a reportable disease, the most urgent category, which is report to the health department within 4 hours if you know of a case. And so that's particularly important in this case because we're not the only ones doing the testing. It's certainly possible that a patient could see a provider and go to a private commercial lab, be tested, get diagnosed, and public health would not even be in that loop. And so that's why we issued this rule to make sure that we found out as quickly as possible.
Any other questions, media?
I guess I have another. When you're talking about traveling, I know we have the Port of Mobile and Carnival cruises and things like that. Are those being shut down, or what precautions are we taking with that?
Yeah, that's a great question. We have guidance on that from CDC. The guidance is a little bit different in different parts of the country depending on where the ship is going and whether there have been cases or not. As we have said many times today, we've not had confirmed cases here, and cruises from Mobile are not going to those level 3 countries or parts of the world where there are widespread community transmission or outbreaks. So the best guidance that we have now from CDC says that travelers who are returning on a cruise that has an actual case of COVID-19 should go home for 14 days, monitor themselves, or we would monitor those people, and they would report to us, and they would check temperatures, and we would make sure that there are no more cases. For travelers returning from cruises that do not have a case of COVID-19, the best guidance from CDC now just says that those travelers returning should monitor their own health, and they should be aware of social interactions, and that's basically all it says. And I think we have interpreted that to mean that we would like people to be educated on the possibility that disease could be transmitted, to be particularly aware about being around family members or friends who are older or who have chronic health problems or who might otherwise be put at risk. But most importantly, to be aware of their own health status and contact someone if they were to have problems. There are no cancellations in Alabama, and I'm not sure about other states, though.
So what about parents who are concerned about sending their children to school at all? You know, absenteeism is a big deal. It's on the report card now. What would you say to parents who are concerned about, you know, can I keep my child home? Should I send my child to school?
If children, if they're not running fever, then send them to school. Again, you know, we do have some information now because this worldwide's been going on for a few months. As the Director Hastings mentioned, mortality rate among children is extremely low, almost non-existent. And so we think that continue to send children to school. We're not so much worried. Certainly there could be isolated cases where there are other health issues and a child can become more serious, could end up being hospitalized. But for the most case, where children have gotten this particular illness, they've been okay and they've recovered pretty well, and it's been more like a mild cold. What we're more worried about, obviously, are children who may be carriers, and then taking that to elderly folks in their family or in their community. So that's why we're very cautious about that. But we say send those children to school. We are monitoring. Schools have really stepped up their cleaning. We're doing a lot more just to try to remind children, wash those hands, covered sneezes and coughs, as has already been mentioned this morning. But, you know, that's something that teachers are doing all the time. We are constantly, because we're always dealing with the flu every year, we're dealing with other illnesses, and so teachers are constantly making sure that students are washing their hands, taking care of themselves, taking care of their friends, and trying to make sure we don't spread sickness in school. And it's really those age-old prevention methods that are the prevention methods, tried and true, that are going to work in this situation too. I would say, though, we are worried about people overreacting and holding their children at home. And I would advise against that. Schools are doing their part. If we have a confirmed case in the schools, I said earlier, we're going to close that school, we're going to deep clean that school, we're going to assess that community and decide what's the best thing on an individual basis for that school and that community. But right now we don't have any such cases. So students need to be in school, need to be learning, need to be playing, need to be doing all the things that kids do every day. And we as adults don't need to overspread fear to children. We need to be responsible adults. Yes, making sure they wash their hands and that they're safe around their friends and those kind of things. But at the same time, it's really safe to go to school, and kids need to be in school unless they're symptomatic. And then obviously we do expect them to stay home.
And we're going to send them home if they become symptomatic. So.
Yeah, very good question, Ms. Ventress. I'm not sure if everybody could hear her, though, so I will repeat that. If a student becomes ill at school, if they're running a fever at school and they're symptomatic, we're going to call the parents and send them home and expect them to be home till they've been fever-free for 24 hours?
72.
72 hours.
Without Tylenol or ibuprofen.
So fever-free on their own for 72 hours before they should come back to school. Any other questions?
One more about traveling. When we're talking about traveling, if we do get a case here in Alabama, will we cut off rest areas on highways and things of that
Not
nature?
school travel. I don't know about that.
Yeah. I think the answer to that is that decision hasn't been made. We certainly have talked about how we might respond, and what our state has developed is really an incremental response depending on the situation. So an isolated case would merit one level of response, or local transmission within a family or in a small area might might lend itself to a more stringent response. If we have widespread, transmission throughout the state or throughout the country, then that's obviously a different level of response altogether. Many states that are having community spread now have begun to limit large gatherings of people or certain types of social interactions. There have been some parts of the country that have canceled a concert here or rescheduled conferences there. And so I think all those are possibilities depending on the level of response that will be required. So.
Okay, well, I want to say thank you again to the folks who are up here with me on the stage. A big thank you to Governor Ivey for putting the task force together and making sure that we were coordinating efforts across the state. And certainly thank you to everyone who gathered here with us today to make sure we get out the right message to folks in Alabama that we have a plan. We're monitoring the situation closely. Schools are working closely with one another, with our department, with the Department of Public Health. Please, 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 parents, make sure those students are washing hands, covering coughs, covering sneezes, those kind of things. If they're symptomatic, keep them at home. And if you have issues and you have symptoms and you believe that a person in your family might be infected, then call your health care provider first. Before you go see them, call your health care provider and let them give you advice on what to do next. And again, thank you all for being here today.